Students, Poonam,
Yes, sir.
how many students were there in previous class?
9, sir.
No, previous class.
27th.
So I think we should not wait for more students to join, and I will start because I have to finish within time and topic is lengthy.
Okay, sir.
Who is the host? So can you all see my screen?
Yes, sir. Yes, sir.
Yes, sir.
Yes, sir.
Yes, sir.
So today we will be discussing how the teachers will teach you, and as you are also a stakeholder of that process, so we thought you people also to make familiar with the teaching methodologies that we will be adopting, and this teaching methodology has been imparted recently by National Council of Indian System of Medicine, and you are among that very first batch who will be exposed to all these changes. You must be aware that up to this batch, means last batch, the first year was of only 1 year. Now it is of 1.5 years. Do you know this? Hello? Has anybody told you this?
Yes, sir. We know it.
Sir, yes, sir.
So,
Yes. So you will have ample time to study the text, and so in order to make it better, the teaching learning process, there are some methods, and Some of those methods we will be discussing today. So the purpose of today's discussion with you people is to develop a clear understanding of what cognitive domain of Bloom's taxonomy is. There is one teaching learning method which was developed by Benjamin Bloom 5 to 6 decades ago, which later evolved and is a full blown Bloom's taxonomy. And there are 3 domains of that taxonomy, and one of the domains is a cognitive domain. So I'll tell you what this cognitive domain is. And we will also see how it can be effective as a teaching methods, and how student can apply it in the process of learning, and how a teacher can apply it in the process of teaching. Because the ultimate purpose of teaching is to make you people capable of handling a patient. Since you are entering into the field of medicine, so ultimately you'll be practicing in the field. So at that time, you'll be encountering a live patient, and while examining that patient, while diagnosing that patient, while planning a treatment, while making a strategy about the treatment, you will have to apply whatever has been taught to you in the school, in the college, right? So the whatever teaching is done in the institute, that should make you people capable of practicing the same in the field on a patient. Then only we will consider, or we will accept that the teaching was good and that you learned whatever has been taught to you in the school or classroom. So this was a person who invented the taxonomy, and his name was Benjamin Bloom. Taxonomy per se means the science of organizing things and classifying them according to various criteria. And Bloom's taxonomy stands for a series of cognitive skills and learning objective arranged in a hierarchical model, often represented visually in the form of a pyramid. Hierarchy means upward se niche. How these are arranged, we will see. So these are 3 domains of Bloom's taxonomy: cognitive, psychomotor, and affective. So cognitive is related to what we think, what our mental skills are, and what knowledge we have perceived or received, or we are going to receive or perceive. Next domain is the psychomotor domain, where you will be practicing the skill, or you will be demonstrating a skill what has been taught to you. For example, blood pressure measurement is done in this way. The definition of blood pressure is XYZ. For measuring a blood pressure, a patient should be in a particular position. A BP cup should be wrapped in a particular way. This is all theoretical. This a teacher will be teaching you in a classroom, and this information is given there in the text also. But the information and this teaching will only be effective if you are able to demonstrate us the process of measuring a blood pressure on a patient, right? So there are a number of procedures which you will be performing when you'll be practicing in the field or practice as a doctor. And all those skills comes under the domain which is called as a psychomotor domain. And there is a third domain which is called as affective domain. Affective domain is related to the emotions of a student, how his or what type of attitude he or she has, and what type of a person he or she has. Because if one stimulus is applied to all, emotional stimulus I'm talking, the response of every student will not be same. Are you getting me? If I tell you one thing, or I give you one thought and ask you to interpret that thought and give you a reaction to that thought, It is not possible for me to have equal response from all, because all of you have different thought process, different personality, the different culture you have been into, the different atmosphere you have been into since childhood. So that all has something to do with the current emotional status of yours, current personality of yours, and that will be affected, and that will affect the teaching and learning method. So this is a third domain. So how many domains are there? Can anybody read out?
There are 3 domains.
Cognitive, psychomotor,
Psychomotor,
and
Effective.
affective, right? And affective. And this is a hierarchical model. So today we will be focusing on cognitive domain mainly. Psychomotor and affective we will see subsequently. So this was original hierarchical order which was designed by Benjamin Bloom in 1950, almost 72 years ago, which has been revised in 2000, and the titles of these hierarchical positions have been changed. So earlier, if we go from bottom upward, the first one was knowledge, which is now called as a remembering. Then comes comprehension, which is now known as understanding. After that, there is application, which is now known as applying. Fourth one in list is analysis, which now is called as analyzing. After that, number 5 is the synthesis, and number 6 is the evaluation. And there is a flip-flop here. The synthesis has now been taken on top and is named, or rather renamed, as a creating. And evaluation has been placed on number 5 and now is known as evaluating. So we will be studying this. So from where it starts from remembering. Second is understanding. Third, applying. Fourth, analyzing. Fifth, evaluating. And sixth, creating. Avanti Dhananjay Joshi, are you there?
Yes.
Yes. So can you read it out from bottom to top? Remembering.
Remembering, understanding,
Hmm.
applying, analyzing, evaluating,
Evaluating and
creating.
creating. Right. So these are 6 domains. Huh? So what were first 3? Remember, understand, and apply. And top 3 were analyze, evaluate, and create. So we can divide it in 2 separate domains, subdomains. One comes into area where a low order thinking is enough, and another comes under area where certain high level of thinking is required. So we have 2 set of domain here, subdomain rather, low order thinking and high order thinking. Low order thinking comprises remember, understand, and apply, and high order thinking comprises analyze, evaluate, and create. As you become expert, you will be entering into this high order thinking area. Right? Remember and understand is up to a certain level, is into the theoretical area only, or see subtle part of understanding only. But difficulty starts when you start the concept applying, when you start analyzing how the things work. And again, higher level of intellect is required to evaluate that process. And out of these, much more skill, understanding, and knowledge is required to create something. So these 3 domains, or these 3 levels, upper 3, analyzing, evaluating, and creating, are high order thinking. And remember, understand, and apply are low order thinking. So this is a pyramid. So bottom 3 are remember, understand, and apply. Top 3 are analyze, evaluate, and create. So how this will be used as a tool by we teacher. So for a teacher, it helps develop critical thinking skills and higher order cognitive ability. We will make you people to think in higher order fashion. We will not stop ourselves making you people familiar with what is there in the text. We will help you and we will make you apply the information which is given there in the text also. So we will study today's topic with example of blood physiology. So have you studied physiology of blood up to standard 12th?
Yes,
Was
sir.
there in syllabus? Yes. So it will be easy for you people to understand. So what was the first level? First level was remembering, right? First level was remembering. So remembering stands simply recalling or retrieving previously learned information. So that what that information can be, that information can be facts, some ideas, or some very basic concepts. And we will see how much of that information which has been given to you, which is there in the text, is remembered by that student. So I'll give some examples here, right? Like as you said that blood physiology was there in standard 11th and 12th. So I will ask you a simple question. What is the normal range of RBC? Kole, Kajal Yadav,
Yes, sir. 3
Kajal.
millimeter to 5
Huh?
millimeter.
What is normal? Huh?
3 millimeter to 5 millimeter. But
Milliliter? No, it is in millions.
millions.
3 to 5 millions. Whatever, right? So this you have to remember, na, whatever the range has been told to you, whatever range is there given in the textbook or lab report, that you have to remember, and this you have to recite again and again. Like since you are in Ayurveda now, we will be telling you to recite some shloka, 2 lines, one-liner shloka, and you will have to read it repeatedly. In order to remember it, you'll have to recite it repeatedly. Then only you'll be able to recall that shloka. So the same things apply here also. Same things apply here also. So in physiology, you will have to learn and remember variety of normal values. What is a normal hemoglobin? What is a normal creatinine, urea, serum protein, albumin, globulin, SGOT, SGPT, and whatnot. So there are numerous ranges and values which you all have to remember. So this comes in a first stage of a cognitive domain, right? I may ask you to define something which is there in the blood physiology, like what is a chemotaxis? Chemotaxis is a process which is a part of inflammation. Describe the role of intrinsic factor in maturation of RBC, right? List the factors involved in the process of clotting, or recognize oxygenated and deoxygenated hemoglobin. We can ask you to draw the diagram of a diapedesis, or we can ask you people to identify the type of cell under the microscope. We may simply put some slide under the microscope and we'll ask you to identify that slide. So this is a very basic requirement of a learning, right? And we expect 100% student to comply with this, because this is an essential requirement of a learning process. Are you getting? So this is from the first level of a cognition. Is clear to all? Bhushan Thakre.
Yes, sir.
Yes, है ना? So if you have any questions, you can stop me and ask the question in between. So this is a must for all students. All students must know how to learn and remember the things and recall the things. जिसको अपन हिंदी में रट्टा मारने बोलते हैं, मराठी में पाठांतर म्हणतो अपन, right? So this everybody will have to comply with, because this is the first level of a cognitive domain. Second level, which was the second level? Applying. Now, we know that normal range of RBC is a certain XYZ, right? We know that this type of a cell is seen, this type of a cell is there under the microscope. But what is the use of this information? What is the use of this knowledge? Since you remember what is the normal range of RBC, but if you happen to see the reports of some patient who has a low RBC count, then you will have to apply that knowledge, right? And that is the place where the importance of a remember comes into the picture. If somebody comes to you with a hemoglobin of a 5 g%, you will be able to say that this patient is anemic only when you know a normal range of hemoglobin, isn't it?
Yes, sir.
Yes,
Sir.
and so for that you have to know what normal hemoglobin, what amount of a normal hemoglobin a patient or a person must have, right? For male, for example, the normal range of hemoglobin is from 12 to 16 grams. And if somebody comes to you with a report of a hemoglobin, say 9 g%, so you will diagnose that patient as having anemia, right? So how have you applied this, that this patient has anemia? Because you know what the normal range is, right? So in order to apply whatever has been learned by you people, you have to be thorough in first level of that cognitive domain, which is remembering. Then only you'll be able to apply the knowledge, right? As far as physiology of blood is concerned, where the application comes into play, for example, I may ask you what would happen to the retic count, reticulocyte in the blood if there is a rapid destruction of RBCs, right? So what is reticulocyte? Reticulocyte is immature RBC. It comes into the bloodstream just at the onset of getting fully matured. If someone has a disease where there is a rapid hemolysis going on, RBCs are getting destroyed, a patient has developed some abnormality where, like sickle cell disease or any other disorder where a hemolysis is happening or going on. In that situation, what bone marrow will do? Bone marrow will see that the blood is supplied with enough amount of RBCs, but as it doesn't have mature RBC, what it will do? It will keep on pushing and pouring abnormal, immature RBC into the bloodstream, right? So if I want to diagnose that the patient has a hemolysis, what would help me in diagnosing? I will see the retic count of a patient, reticulocyte count of a patient. That pathologist will give me that reticulocyte count in a report. And if it is more than 2% or 3%, then I'll be able to apply my knowledge and will suspect that the patient is having ongoing hemolysis. Hemo stands for blood, lysis stands for destruction. Are you getting me?
Yes.
Yes.
Yes,
Right?
sir.
Yes. Yes. There is another example of a transferrin. Transferrin. What would be the result of a transferrin? You all know that hemoglobin exists, and hemoglobin requires iron for its synthesis. And this iron is transferred by a protein which is called as a transferrin. So this is a vehicle. This transferrin is a protein which is a vehicle which transmits that ferrous or iron into the hemoglobin. It carries iron to bone marrow by whatever means it does. If the levels of transferrin are low, do you think that the patient will have normal hemoglobin? No, because the transporting agent is not there in adequate quantity. So eventually the patient will have anemia, right? So this is how we will be applying the knowledge, what we have learned when we learned when we were in this first level of domain. And this first level of domain is remembering. And this remembering further is being extended to what? Applying. So I hope that all students have understood what is there in first two domains or first two levels of domains, cognitive domain. Yes. Ganesh Shejul. दिव्या शेजूळ नहीं, दिव्या नागोसे.
Remembering and applying.
Applying. Ganesh Shejul, where is Ganesh Shejul? Gunjan Meshram.
Yes, sir.
Yes. Now, which is third level now? It is
Analyzing.
analyzing, right? Analyzing. Now, you must have heard the term heart attack. Have you?
Yes.
Yes,
Yes,
sir.
yes. So yes, this somebody
Sir.
had a heart attack and had to be hospitalized, or somebody had a serious heart attack and died because his acute myocardial infarction was so fatal, right? So this sentence or statement is okay for a layman, but as a doctor, you must be able to analyze what could have happened in case of acute MI, which events could have caused the acute myocardial infarction or heart attack in a patient. So you'll be thinking that there was something which caused occlusion in a coronary artery of that patient, which led to arrest of a blood flow to the myocardium. And when that arrest is 100%, when that artery gets totally occluded, the patient will develop necrosis to that part of a myocardium, right? And that will lead to hypoxia. The oxygen will not be supplied to that muscle, and that muscle will suffer or undergo a process of necrosis, which we call as a infarction. So why there was a 100% occlusion? This occlusion was because of a thrombus, right? So that thrombus can occlude 100% lumen of that coronary artery, or it is possible that patient might have had some occlusion from the atherosclerotic plaque, which is because of a deposition of a cholesterol within the coronary artery, right? So patient might have had 60%, 70% occlusion previously also, and now that 30, 40%, whatever that coronary artery lumen was open, that has been occluded by a thrombus, right? And because of this occlusion, there was a sudden cessation of a blood flow to that affected muscle of a myocardium, which has caused heart attack. So how this how this has been understood by you people, because you have analyzed the series of events. And for this capacity of analysis, what is required? You have to have the knowledge of previous two domains, remember and applying. Then only you'll be able to analyze, right? Another example I would give you that this explain what would happen to RBCs in a case of a patient who is having chronic renal failure. So do you know that there is one hormone which is secreted by kidney which controls the production of RBC? Can anybody name that hormone?
Erythropoietin.
Erythropoietin. Excellent, excellent, right? So if the kidney fails, will that erythropoietin be secreted in normal quantity? No, right? If kidney is not functioning properly, there will be no production of or no secretion of erythropoietin. So if there is no erythropoietin, will RBC be produced normally? No, right? So patient will develop anemia. So is it that patient is having deficiency of iron in his body? No, it is not. Is it that patient is having low transferrin level? No, it is not. Is it that patient is having altered total iron binding capacity? No, it is not. Everything is fine. Patient is having good amount of nourishment as far as iron in the food is concerned. Everything is fine. But what is lacking? Erythropoietin is lacking. That amount is lacking, and that is required. So, what would be the treatment of anemia in patient of a chronic renal failure? It would be synthetic erythropoietin only, right? So, how you have analyzed this? Because you know things, right? Because you know the knowledge, you have the knowledge, you know how to apply it, and after that only you are able to analyze that. So, for this, what you will have to have? You will have to have the patients having symptoms of a chronic renal failure. You will have to have ultrasonic evidence that his kidney size is small, kidneys are shrunken, his creatinine is more, his urea is high, right? And his hemoglobin is low. So this all gives you a clue that patient requires erythropoietin. He will require iron also, but in not in that amount, right? If you give him enough iron, then also his anemia will not recover. He will not improve. We will have to give him erythropoietin only, right? So this is a third level of a cognitive domain. So can you all see the picture here?
Yes.
Yes,
Yes,
sir.
sir.
So you must have studied the coagulation pathway also in 11th and 12th, is it?
Yes.
Intrinsic, yes.
Yes.
So can you tell me which this pathway is? Intrinsic or extrinsic? So the picture, it is given, yes, blood clotting is there. So this pathway is intrinsic pathway of coagulation, clotting, or extrinsic pathway. There are two pathway, no? Everybody knows.
Yes.
So which is this pathway?
Extrinsic.
Huh?
Intrinsic.
Intrinsic. Who is this?
Sir, me,
What is your name?
Vidhi Verma.
Vidhi Verma. And who said extrinsic? Somebody said extrinsic also. Anyway, this is intrinsic pathway. Why this is intrinsic pathway, Vidhi? The
Sir,
answer is
because
correct.
this is the process of formation
Yes,
inside.
no, but the clue here is that there is a trauma to the blood. Have we said that there is a trauma to tissue? No. From where that process has begun? The process has begun after the blood is subjected to trauma. Are you getting me? So this is intrinsic process because there is a trauma to blood. So whenever blood suffers some sort of a trauma, it will start developing clots in the body. So this is how this level of a analysis has to be understood. Now, how many levels have we studied? Shahana Sayyed?
3 levels.
Can you name them? Samadhan Borkar? Samadhan sir.
Knowledge, apply and analyze.
Now knowledge, apply and analyze. Now we will move on to the fourth level, which is known as a understanding. So now we have information, right? We know how to apply that information and we know how to analyze those things. So this will develop our process of understanding. So at this level, we will be able to comprehend information and grasp its meaning. We'll be able to translate the things, like the reports are there printed on a paper, and we'll be able to translate in some sort of a diagnosis, right? We will be able to interpret what the value means, what that finding means, right? So X-ray report is saying something on a paper, on a sheet, or on a film, but you'll have to interpret it, whether it is a pneumonia, whether it is a bronchitis, whether it's tuberculosis, right? And from that, you will have to identify the problem. And so as to identify the problem, you must understand the process. In medical field, if we speak of a process, it is a disease process with pathogenesis, right? And after understanding the process, you will have to state that process or a problem in your own words, right? So that diagnosis will be different for you, and that interpretation of diagnosis will be different for patient, right? So what you are doing at this level, you are understanding the things. So if I have to give some examples to you, then I may ask you, what are the characteristics of inflammation? What is inflammation? Inflammation is a response of a response of a tissue to injury. If some tissue suffers a trauma, it may be mechanical trauma, chemical, electrical, thermal injury, whatever. To that injury, a tissue will respond. How it responds? Because of a damage, there is a increased blood flow to that affected area. There is vasodilatation, right? There is increased traffic of monocytes, macrophages, right? Phagocytes. So there will be a swelling over affected area. That area will be warm to touch, right? That area will be painful on touch. You must have experienced this, no? कभी आपको मार लगा होगा हाथ पे, कभी वुंड हुई होगी, तो उसमें ये सब चीजें आती है ना? So there are 4 cardinal symptoms or signs of inflammation: dolor, calor, rubber, and tumor. This you will study when we will start teaching these pertinent chapters, right? But this understanding comes only after you have mastered yourself in earlier 3 categories, right? Because from this 4th category, we have entered into a zone of a high order thinking. Before this, we were into a zone of a low order thinking. Is it right? Yes.
Yes, sir.
Yes, right. Now, can you tell me what would be the result if transferrin levels in the blood are too low? This example I have given to you. So what would happen if transferrin levels are too low? Yes. Come on.
Hemoglobin level will
Yes.
goes down.
It will go down, right? After that, we will move on to the next level of cognitive domain, and it is known as evaluating. So from understanding, we are now starting judging the things. So whatever ideas we have developed and whatever evidences we have collected and whatever viewpoint and perspective we have because of our personality, right? Because for one thing, I may have certain viewpoint and my friend or my colleague may have certain viewpoint. And that's why there is a concept of a second opinion in a very medical field. आप एक डॉक्टर के पास गए, उसने आपको XYZ डायग्नोसिस बोल दिया, लेकिन आपको लगता है कि और कुछ हो सकता है, you can have second opinion, right? You can go to some another doctor and can ask him, what does this mean? Is this diagnosis correct? What is the prognosis? What are the chances of getting the patient cured, right? So this depends upon the perspective someone has, and this perspective may differ from person to person. And this perspective is reflected when somebody starts evaluating the things, because in evaluation, a person's own persona and thought process is also seen as involved in making decisions, right? So in this stage, we will be asking you questions like select the most effective solution for immunity against COVID-19. You all have experienced how dangerous the time was during COVID-19. If I ask you what was the treatment, now everybody knows that there was no effective treatment against COVID-19. But many Ayurvedic pharma companies, many Ayurvedic practitioners suggested some sort of immunity preparations to patients. And patients consumed those preparations also, right? But we don't know what worked well, which immunity product, which immune booster worked in which patient, and was they really effective or not, right? So this sort of a thinking process require higher level of knowledge, because the answer is not simple. You cannot answer this in one sentence, right? Another situation, I can ask you people to see the arterial blood gas report, ABG values, and diagnose the underlying condition, right? Not every student will be able to do this, because this requires certain higher level of thinking. So this is level 5, which is called as a evaluating. And I can give you a report of a CBC, complete blood count, and can tell you to identify what problem the patient has. I can ask you to reach the conclusive diagnosis. Now, hemoglobin is 8 gram. What is the diagnosis? Anemia. Anemia, right? Yes or no?
Yes.
Yes, sir.
Yes. But if somebody has hemoglobin of 12, what would you say? There is no anemia. You would say that there is no anemia.
No
But what
anemia.
about other parameters? And the report of a CBC will not have only hemoglobin mentioned there. It will have other indices also, like mean corpuscular hemoglobin, mean corpuscular hemoglobin concentration, mean corpuscular volume, right? Random distribution weight. There will be multiple parameters, multiple variables written on the reports. So you'll have to see that report comprehensively. It is possible that patient may have mean corpuscular volume more than the defined range. That means his size of RBC is more large. It is large, and which is called as a megaloblast. So megaloblastic RBC is not a good quality RBC. This patient will still need a treatment despite having normal hemoglobin. It means that quantitatively, though his hemoglobin is normal, but quality wise, it is not good. Understood? आपको मैंने बताया कि 1 किलो आम लेकर आओ मार्केट से, और आपने लाए और घर में बोल दिया कि 1 किलो आम है, और आपकी मम्मी ने बोल दिया इसमें से आधे खराब है, तो चलेगा क्या वो? नहीं चलेगा. समझ रहे ना? तो सेम नहीं चलेगा, right? So even if a patient or a person has a normal hemoglobin, but you'll have to see whether it is a good, it is good from quality perspective, है ना? The RBC, shape of the RBC, whether it is a normocytic, है ना? Microcytic RBC अगर छोटी है तो that is microcytic. It is not good RBC. अगर बड़ी है macrocytic, it is also not good, right? The hemoglobin within the RBC must be of a good quality
Normal
and
size.
quantity. Yes, so the mean corpuscular hemoglobin concentration, right? So normochromic, normal hemoglobin within RBC, normochromic, hypochromic hemoglobin कम हो गया, right? Hypochromic. So there are variety of angles to the single CBC report, and without having knowledge of all these things, without knowing how to analyze and apply this, how to understand this, you will not be able to evaluate the report of a patient. And if you don't do this, you will not be able to reach to the conclusive diagnosis of a patient or in a patient. Are you getting me? So this is
Yes, sir.
important. So this is important. Now we will come into the last level of cognitive domain, which is called as a creating. So this is a most higher level of thinking, or a higher order of thinking, which generates an ability in you to bring together information to solve a problem. अब तक क्या किया हम लोगों ने, we diagnosed the patient that this patient is having megaloblastic anemia, but is this diagnosis sufficient? No, because the patient has come to you with certain complaints. Now he wants a solution for that. He wants his problem to get solved, right? And in order to solve his or her problem, you will be able to design a process for effectively screening for anemia, which you have done. We have just seen that that particular report has to be seen from this particular angle, right? Then we will take history of a patient. Is he non-vegetarian, vegetarian? Is his food intake okay? Is his food enough in nutritious products? Is his iron intake okay? Does he having some bleeding problem? Is he having piles, fistula, or is there any source of bleeding from somewhere else? If the patient is female, does she lose more blood during menses? These sort of questions we'll be asking. And after this, we will create a plan for a treatment. If the patient's hemoglobin is normal and if he is having megaloblastic anemia, then we will be able to reach a conclusion that the patient is having vitamin B12 deficiency. And only thing required is administration of vitamin B12. उसको आप B12 के 4-5 इंजेक्शन दे दो 2-3 दिन के गैप से, उसका अनीमिया ठीक हो जाएगा, उसका मेगालोब्लास्टोसिस ठीक हो जाएगा, right? So this we expect from a student to do, and this is a last level of a cognitive domain of a Bloom's taxonomy. So can you recite once again what are the 3 levels which were there in higher order thinking? Sayyid Mufais, Vaibhavi.
Knowledge, apply, analyze, understanding, evaluating, then creating.
Creating, but what are the 3 levels which were there in higher order thinking zone? HOT.
Creating, create, evaluate, and analyze.
No.
Analytical thinking,
Sir,
practical thinking,
Sakshi,
practical application,
Remembering, understanding, and
and
creating, right? The understanding, creating, and evaluating. So this is a part of a higher order thinking, right? So how many of you would like to fall or enter into this zone, higher order thinking? Everyone? Only brilliant student or
sir.
smart and
Yes.
yes, right? So you should aim or you should target entering into these zones, higher order thinking zone. If you want to become a good doctor, right, then it is must that you should explore these areas. Just a moment. So this is for our teachers. Now we will move on to the part B of today's session, which is assessment. Now we have taught you certain things, and now it is time to conduct an examination, periodic assessment, or 6 monthly exam, or annual exam, or university exam. So how would teachers examine you or assess you? So this assessment, there are certain methodologies which have been designed by educationists in the past. And one of the most famous assessment which is used for evaluating a student is called as the Miller's pyramid of assessment. So George Miller, he was basically a psychologist, and in 1990 he designed this pyramid, which is called as a Miller's pyramid. So here also you can see in the bottom the word written is novice, means someone who is new to the field, as you are at this moment. You are new to the field of Ayurveda, new to the field of medicine. And what from this new or novice person, what we want to create? We want to create someone who is what?
Expert.
Expert, right? Expert. So we will be taking you through these processes. And so we want you people to do things, to practice things, which I told you in the beginning, right? But we will start from where? Whether you know, whether you have certain level of a knowledge. Then we will ask you, you know the thing, but how do you know how this happens, right? So anemia causes fatigue. This you know, but I will ask you how anemia causes fatigue. Can anybody tell me?
Due to lack of RBC, sir.
RBC lacking, RBC, low RBC are there, but how does it cause fatigue, exhaustion?
Due to lack of oxygen.
Oxygen. But is it not that patient
Muscles don't get proper oxygen.
Your voice is breaking.
Sir, we are unable to hear you.
my voice? Hello, student, am I audible?
Yes, sir.
sir.
Now,
Yes. So how that patient is developing fatigue? RBCs are there, oxygen is also there, but there are no enough RBCs to carry that oxygen. That's why he's developing fatigue. Is this clear? So this means that you know how that is happening. Understood?
yes, sir.
Yes. Now the level next to this is shows how. You people know what the blood pressure is. You can define the blood pressure. You know that this is a sphygmomanometer and this is a cuff, this is a bulb, and this is mercury manometer. You can describe the process of measuring a blood pressure to me, right? But I'll ask you to show how the blood pressure is measured. Then you'll have to describe the process. And in the end, I'll ask you to measure the blood pressure actually in a patient. Means I'll be asking you to perform that particular process or procedure. And then only there is a meaning of learning about the concept of a blood pressure, right? Is this okay? So what are 4 steps here in a Miller's pyramid? First is
Knowledge.
nose. Second is
Knows
how. Third is
understand.
shows how. And fourth is
Does.
right. So knows how, shows how, and does. Knows is a knowledge. So we'll now directly go on to the syllabus. Just a moment. So this is your syllabus of human physiology Kriya Sharir, which has been designed by National Council of Indian System of Medicine, right? So I'll give you example from modern physiology only because you people are not yet familiar with Ayurvedic Kriya Sharir, and I will let you know how these teaching methods will be applied during the teaching learning process. मैं बेटा 20 minutes बस थोड़ा सा क्यों हाँ. So you can see that this is a part B of paper 1 and the topic is homeostasis, and the time over which we'll be teaching you this particular topic is 6 hours, which will comprise 5 lectures. Out of these 5 lectures, out of the 6 lectures, 5 lectures will be classroom based lectures and 1 lecture will be non-lecture, means a discussion or demonstration or a group teaching, anything, it can be anything, right? So can somebody read CO1 here, course outcome? Nitin Jadhav. Priya Maske.
So may I?
Yes.
Sir.
CO1 means course outcome 1. So that is for us. But can you just read what is written here? CO1.
Define homeostasis and describe mechanism of maintenance of homeostasis.
Homeostasis. Right. So in which domain of Bloom's taxonomy this falls? Comprehension. Comprehension, right? Cognitive domain. And what this MK is? Must know. And then KH is know how, knows how, right? So this part is must know for all students, means everybody should know this. There is no other option. Not only this, you should also know, it is required that it is required for a student to demonstrate us that how does he know this or in what way he knows this, right? So knows how. What is the concept here? Define homeostasis and describe mechanism of maintenance of homeostasis. So this part of a syllabus or this requirement of this particular point in a syllabus is essential for all and everybody must know this, right? So this falls under the category which is a must know, and this can be there in a written examination also and can be asked during vivas also, right? So this all part homeostasis comes under must know, means every student must know this part. And I'll show you. Yes, can anybody read this?
Describe and discuss transport mechanism across cell membrane, active and facilitated.
Now, right. Again, the domain is cognitive comprehension, and here it is written as a DK, right? It is not written as a MK. MK stands for must know. DK stands for desire to know, right? So we want some brighter student to know this, or else the student who knows this will be considered as a brighter or intelligent. Are you getting me?
Yes, sir.
Yes, sir.
So would you like to fall in this category?
Yes, sir.
Yes, sir.
Yes.
Sir.
समझ रहे हैं ना आप लोग? मतलब मस्ट नो वाले जो बच्चे रहेंगे वो एवरेज, समझ रहे, या फिर न पढ़ने वाले बच्चे रहेंगे या कम पढ़ने वाले बच्चे रहेंगे, राइट? डिजायर टू नो वाले बच्चे कैसे रहेंगे? जो 60%, 70%, 80%, 90% की रेंज में रहेंगे, वो बच्चे डिजायर टू नो वाला भी पढ़ाई करेंगे और वो भी हमको डेमोन्स्ट्रेट करेंगे, वो हमको बताएंगे कि वी नो दिस, राइट? So this is a desire to know. I'll show you one more thing here. Yes. Can anybody read this? Somebody else now.
Yes, sir.
Hmm.
Describe Haldane effect and
Kusumoval's breathing, right?
Kussmaul's
So
breathing.
yes. So this is abnormal type of a breathing which we see in patients with head injury or say ketoacidosis. Whenever there is a change in the blood pH, right, the breathing is affected. If the patient's blood is too acidic, if its pH is below the required level, then patient will have certain type of a breathing which is called as a Kussmaul's breathing, right? But if some student know this, it is very good. Will be very happy to know that this particular student is aware of this particular concept. And what is written here? Nice to know. So this is must know, desire to know and nice to know. तो जो बच्चा ये nice to know वाली चीजें जानेगा, वो कौन सी रेंज में रहेगा? वो 90-95% वाली रेंज में रहेगा। समझ रहे हैं ना? मार्क्स की बात छोड़ दो आप लोग, मार्क्स के हिसाब से कैटेगराइजेशन हम लोग नहीं करेंगे, नॉलेज के हिसाब से, उसका इंटरेस्ट के हिसाब से, समझ रहे हैं ना? सिलेबस में जितना दिया है 4 पन्ने, उतने ही 4 पन्ने वाले बच्चे हमको नहीं चाहिए। हमको उसके बियॉन्ड जाकर उसको और एक्सटेंड करके, उसको और एक्सप्लोर करके पढ़ने वाले और उस नॉलेज को डेमोन्स्ट्रेट करने वाले बच्चे चाहिए। तो ये कौन सी कैटेगरी में आ गया है? ये नाइस टू नो, राइट? So it is not like that we will not be teaching this to you people. We will be teaching everything, irrespective of whether it is from nice to know area, desire to know area, or must know area, right? But what we expect 100% student to know everything which is written there in must know category. Is this clear? So this is
Yes, sir.
essential, right? If you consider yourself as a student who is above average student, then we expect you people to know the things which are into a desire to know category. But if you think that you are excellent, you are super intelligent, then we expect you to know the things which are mentioned in nice to know category also. Understood?
Yes, sir.
Yes, sir.
Yes, yes. So there are various methods with which we will be doing this. So you can see here that the word written here is a lecture, then there is a discussion, right? So what we will be doing, we will be dividing you people in a group. For example, you are a batch of 40 students, so maybe we will divide you in 4 groups, and we will ask you to discuss on some concept. For example, chemical control of a respiration, right? So how PO2 means partial pressure of oxygen and partial pressure of a carbon dioxide affects the process of respiration. What sort of a mechanism is seen there, right? So this we will be teaching you first in classroom. We will be revising also, and then we will divide you people in groups and will ask you to prepare your own write-up, and then we will discuss among each other. Each group, there will be one representative will be asked to stand and to explain whatever you people have discussed, right? So these are some of the teaching methodologies we will be applying. Then there is one word here which is written here is a seminar. Seminar means we will call, say, some expert from another batch or another year. For example, if we are discussing applied physiology of respiration, and then as a teacher of physiology, I have taught you everything, right? But we will expect you people to know the pathological aspect also. And for that, we will require the expert from pathology. So maybe we will be calling some teacher or HOD from pathology department, from medicine department, right? And if you are interested enough, or if you are enthusiastic, then we may call some chest physician from outside who is practicing in Nagpur. That all depends on your interests. The level of interest shown by you will encourage we teachers also. So if you are involved more in the process of learning, that will encourage us to get involved more in the process of teaching, right? So there are various methods which we will be adopting in teaching. For example, vertical or horizontal teaching. The example which I gave you just now was of a vertical teaching. But if we are studying concept, some Ayurvedic concept which is new to you, and if I think that a person from Sahita is a better person which can explain the concept of a Purusha or a Loka Purusha Samya Siddhanta in Ayurveda better than what I can do, so I'll invite that person also. So if some concept is there which is common to Rachana, Kriya and Sanhita, so we all three will be standing on one platform at a time and will be explaining that concept to you. So these all teaching methodologies or strategies will be using while teaching you people or while imparting the education to you. Then online teaching aids and homework based assignment. As far as possible, if audio visual aids are required to show or demonstrate something, because there are a lot of things which are available on YouTube also, or online content is also available. So if we think that that can uh, have a better impact, if that can make the process of understanding easy for you people, so we will be adopting that also, right? So these are some of the few teaching methods we'll be imparting while teaching, and you will come across all these methods as we will move, as we will progress day by day, week by week, and month by month. Let me also tell you that we will be having periodic assessments in between, like in one term of a 6 months, you will be assessed 3 times, right? Means after every 45 days, there will be one assessment. So you will have to undergo 3 assessments in a term. So 3 plus 3 plus 3, 9 assessment, plus examination after every 6 months. So first internal examination after 6 months, second internal examination after 12 months, and final examination will be at the end of 18 months. Plus there will be practicals also. Let me show that also to you. Just a moment. So I'm talking about physiology only, right? This. So can you see how many lecture hours are there? There are 150 hours, total hours. Can everybody see?
Yes,
Yes.
Yeah.
Yes.
Yes,
Yes.
Yes,
sir.
sir.
So yes. So
Yes,
for
sir.
paper 1, there are 75 hours, and paper 2, 75 hours. And out of these, 150 hours are lecture hours and 250 hours are non-lecture hours. Means this 150 hours will be covered in a classroom, and these 250 hours will be covered out of classroom, you can say. Not essentially out of classroom, but the method of teaching will not be a lecture where a teacher is speaking and students are listening silently. So what happens in such cases, it is not possible for every student to be attentive. So we need to have different strategies or different methodologies Like I told you that we will be dividing you people in a group. We'll be asking you to present some topic, right? है ना, श्लोक या कोई भी आयुर्वेदिक मॉडर्न कोई भी टॉपिक हो सकता है. So different methodologies will be using while teaching you the subjects, be it Rachana Sharir, Kriya Sharir or Sanhita. So this is all from me. If you have any questions, you can ask. This syllabus is available on the website NCISM, National Council of Indian System of Medicine, and I appeal you all people to download the syllabus or syllabi of all the subjects so that you can refer it and you can start planning your study from today itself. So I encourage you to ask questions. So I'll stop my screen here, sharing here. Nikita Mane. वैभवी.
Yes, sir.
सगळं समजलं तुला?
Yes, sir. Sir, तुम्ही
नका
ती
sir.
वेबसाईट कोणती म्हटल्या?
NCISM,
ओके सर.
National Council of Indian System of Medicine. हाँ, हे याच्यात काही क्वेश्चन असेल तर मग I'll tell you one more thing. Should I go ahead?
Yes, sir.
Yes, sir.
Yes,
Yes,
yeah. So apart from these essential subjects, Rachana Sharir, Kriya Sharir, Padartha Vidyan, Ashtanga Sangrah, Ayurveda Itihas and Sanskrit. From this year, the National Council of Indian System of Medicine has planned to have electives which are optional. So you'll be given a list of elective and you'll have to select 3 electives from those subjects or topics. The purpose behind imparting these electives is to make you people stand in a society in a very professional way. समझ रहे ना, मतलब इसमें फार्मेसी मैनेजमेंट रह सकता है, इसमें कुछ पर्सनालिटी रिलेटेड कोर्सेस हो सकते हैं, कुछ कंप्यूटर रिलेटेड कोर्सेस हो सकते हैं, समझ रहे ना, कुछ बिहेवियरल एस्पेक्ट, साइकोमोटर एस्पेक्ट रिलेटेड कोर्सेस हो सकते हैं, आई और बायोलॉजी कोर्सेस हो सकते हैं. सो दैट लिस्ट इज येट टू बी made public. The discussion is going on and there will be a separate team who will be teaching you these electives, and that team only will evaluate your performance in those selected electives and the result will be displayed on a website. So that all will be taken care by a separate independent team, but that is a part of a curriculum of Ayurveda. So this is a welcome initiative which is taken by National Council of Indian System of Medicine, and this studying electives will help you people grow your persona. So you have to keep this also in mind. So you should be careful while choosing electives. जिसमें आपका इंटरेस्ट है, जिससे आपको लगता है कि ये पर्टिकुलर इलेक्टिव मैंने चूज किया तो मुझे पढ़ाई में फायदा होगा, प्रैक्टिस में फायदा होगा, मेरा कम्युनिकेशन स्किल इंप्रूव होगा. You can discuss with me also, means as and when that list will be declared, but this will be there and this is good. So apart from the academic subjects, you people will have to study those electives also. Right?
Sorry, sir. I can't get it. Please, can you repeat?
This whole topic.
So,
About electives.
Electives, हाँ.
sir,
Electives
it is
का,
compulsory to choose
yes,
every.
no. So means like, so there will be 3 sets probably, and one set will have 5 electives listed there, and you'll have to choose one elective from each set.
Okay.
Vidhi, what is the confusion?
Sir, we have to choose any one elective.
any one elective. So
Okay.
total 3
From the
electives
set of 5.
from the set of 5, and there will be 3 such sets.
Okay.
So you'll have to choose 3 electives. तीन इलेक्टिव रहेंगे, 5-5 का या 10-10 का सेट रहेगा, उसमें से एक एक चूज करना है आपको कोई भी।
सर क्या आप एग्जांपल्स दे सकते हैं इलेक्टिव सब्जेक्ट के नेम्स के लिए, किस टाइप का टॉपिक रहेगा एग्जैक्ट?
जैसे आयुर बायोलॉजी एक सब्जेक्ट अगर है, आयुर बायोलॉजी, तो जैसे आपको आयुर्वेद पढ़ रहे हैं आप, और आप बायोलॉजी पढ़ के आ गए पहले, है ना? हाँ, तो उसका कोरिलेशन कैसे लगाना है, ये एक इलेक्टिव हो सकता है, बरोबर है। सिंपल संस्कृत स्पीकिंग एक इलेक्टिव हो सकता है, ठीक है ना? बायोफिजिक्स एक इलेक्टिव हो सकता है, जैसे आप अभी
जैसे सर हमें इसका नॉलेज नहीं हो सेट ऑफ 5 में, हमारे लिए कौन सा ज्यादा फायदेमंद रहेगा?
तो हम
Like
लोग है
आपने
ना
बोला
उसके,
चूज वन करना है,
हाँ तो हम
तो
लोग है ना
आप
उसके
लाइक
लिए,
हमें
हाँ तो उसके लिए वी विल हैव सेशन, वी विल डिस्कस इन द क्लासरूम, कोई प्रॉब्लम नहीं, समझ रहे? हाँ
ओके
हाँ, वो इलेक्टिव का लिस्ट जब आएगा, अभी तक उन्होंने रिलीज नहीं किया है, बट इट इज प्लान, इट इज इन द प्लान, ठीक है ना? और उसका मैंने बता दिया आपको कि देयर विल बी अ सेपरेट टीम जो वर्चुअल क्लासेस होंगे उसके, और वो भी एकदम हाई फाई सोसाइटी जो एजुकेशनल इंस्टीट्यूट रहेंगे वो आपको पढ़ाएंगे, समझ रहे? तो ये सिनेरियो टोटल ट्रांसफॉर्म करने की कोशिश की जा रही है आयुर्वेद के स्टूडेंट्स को, जो अब तक नहीं था,
ओके।
समझ रहे? जैसे जैसे आप सेकंड ईयर में रसशास्त्र पढ़ रहे हो, द्रव्य गुण पढ़ रहे हो, उसमें आपको मालूम है कि दवाई बनानी कैसे है, लेकिन वो बेचने कैसी है ये नहीं मालूम आपको, समझ रहे ना? तो उसमें फार्मेसी मैनेजमेंट रिलेटेड इलेक्टिव रहेगा सेकेंड ईयर में जब आप जाओगे, समझ रहे ना?
ओके सर।
मार्केटिंग का कैसे रहेगा, आगे दिन में फाइनेंस रिलेटेड इश्यूज कैसे रहेंगे, उसका इलेक्टिव रहेगा।
सर जैसे
सर ये
हमने
तीनों प्रॉप
फर्स्ट
में
ईयर,
रहेंगे?
तीनों प्रोप में रहेंगे, तीनों प्रोप में इलेक्टिव्स रहेंगे।
सर जैसे हमने फर्स्ट ईयर में एक इलेक्टिव चूज किया, तो सेकेंड ईयर में भी वही
नहीं
कंटिन्यू करना
फर्स्ट ईयर में 3 इलेक्टिव, सेकंड में
अच्छा
3।
तीनों एक बार में ही?
हाँ, ये मैं टेंटेटिव बता रहा हूँ जितना मुझे मालूम है, लेकिन मोस्टली ऐसे रहेगा मॉडल।
हर साल नहीं रहेगा वो मतलब?
हर साल रहेगा ना, हर साल में फर्स्ट ईयर, सेकंड ईयर, थर्ड ईयर। हाँ, लेकिन जो फर्स्ट ईयर में आपको इलेक्टिव दिया गया है वो सेकंड ईयर में नहीं रहेगा ना,
मतलब सेकेंड ईयर में हमें दूसरा चूज करना पड़ेगा?
दूसरे चूज करने पड़ेंगे,
अच्छा,
फाइनल ईयर में दूसरे चूज
ऐसे
करने
फाइनल
पड़ेंगे।
ईयर में भी
हाँ,
दूसरा?
वो तो उस ईयर के सब्जेक्ट से रिलेटेड रहेंगे ना वो सब।
सीखना तीनों ही है मतलब?
हाँ, सीखना तीनों ही है, सीखना तीनों ही है, और यू विल एंजॉय दैट।
ओके सर, थैंक यू।
सर हर प्रॉप में ऑप्शंस चेंज होंगे फिर?
हाँ, हर प्रॉप में चेंज होंगे ना, फर्स्ट ईयर में फर्स्ट ईयर के हिसाब से रहेंगे, सेकंड ईयर में सेकंड के, थर्ड ईयर में थर्ड के। जैसे योगा वगैरह है, योगा आपको सेकंड ईयर में रहेगा, योगा भी आप चूज कर सकते हो उसमें, समझ रहे हैं? जैसे अपनी इसमें भविष्य कल्पना है ना, तो लेकिन डाइट और न्यूट्रिशन नहीं है अपने इसमें, तो हो सकता है वो डाइट और न्यूट्रिशन सेकंड ईयर के इलेक्टिव में डाल दे आपको आगे अंदर में, तो आप डाइटिशियन या न्यूट्रिशनिस्ट जो करते हैं वो सब आप सीख सकते हो इलेक्टिव के माध्यम से, जो अब तक नहीं था, समझ रहे हैं ना?
यस सर।
जैसे हाँ, जैसे योगा आ गया तो एक फिजियोथेरेपी का इलेक्टिव आ सकता है ना, ये एक्सरसाइज फिजियोलॉजी का इलेक्टिव आ सकता है, एक्सरसाइज फिजियोलॉजी का फर्स्ट ईयर में भी आ सकता है। सो यू विल लर्न हाउ टू ट्रेन पीपल हु वांट टू रिड्यूस वेट, हु वांट टू गेन वेट, समझ रहे हैं ना? वो सब चीजें आएगी उसमें। हाँ, सो दिस इज एडिशन टू द क्यूरिकुलम, जो सिलेबस है उसका ये एडिशन है, लेकिन ये पढ़ाने का काम हम टीचरों का नहीं है, समझ रहे हैं ना? ये काउंसिल अलग से पढ़ाएगी, उसका प्लेटफॉर्म अलग रहेगा, ये मैं बोल चुका हूँ, उसका इवैल्यूएशन भी अलग होगा। ये प्रोविजनल इंफॉर्मेशन मेरे पास है, जहां तक मैं जानता हूं, मुझे मालूम है, दिस इज सब्जेक्टेड टू चेंज और दिस में चेंज, बट मोस्टली जैसा मैं बोल रहा हूँ वैसे ही रहेगा।
तो सर जो यूनिवर्सिटी लेवल पर एग्जाम होती है उसमें भी इलेक्टिव सब्जेक्ट के एग्जाम्स
नहीं
होंगे?
नहीं 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 नहीं, मैंने बोला ना
उस
आपको
पे
कि
ये
ये
मेन
अलग,
सब्जेक्ट्स होंगे?
हाँ मेन
ओके
सब्जेक्ट का ही यूनिवर्सिटी में होगा, इसका एक अलग बॉडी रहेगा, अलग प्लेटफॉर्म रहेगा, उसका यूनिवर्सिटी
ओके
से कुछ लेना देना नहीं रहेगा।
ओके, ठीक है सर।
हम्म। Right? So if there are no queries, there are no questions, I think I should stop. Waghi sir, are you there? Borkar sir? तो चलो ठीक है students, I think this is your last session, no, of this transitional curriculum.
Yes, sir.
Yes, sir.
Yes, sir.
Yes, sir.
So from tomorrow your classes are starting.
Yes,
No,
sir.
sir.
Yes, sir.
Yes, sir.
चलो ठीक है, so I'll welcome you all and we will enjoy the journey together. So thank you all for attending the class. Right?
Thank you, sir.
Thank you.
Thank you, sir.